So I'm Catherine Sinclair and I'm Head of Research at the Golden Jubilee. So my job is to make sure that all of the projects that we host and sponsor at the Jubilee have got all their approvals in place and are adequately funded and are safe for patients and all that kind of thing. What the Research Institute does is it helps the development of drugs and devices. We've gone from not very much research to what you see just now, which is you see the Research Institute around you and about 160 research projects at any one time. You tend to find that research is quite far away from actual normal use because of the way drugs and devices are developed, but there are some instances now of projects we've been involved in where the drug or the device is now in normal clinical use. I guess our research nurses are specifically employed because they're specialists in the clinical area, but they're also specialists in research, so they're highly specialised nurses. And I think Red4Research just gives us the opportunity to thank everybody. What it is a celebration of clinical research in an NHS environment, so it's UK-wide, supported by, in Scotland, the Chief Scientist Office in NHS Research Scotland. So it's just something that we use to illustrate that huge amount of work that goes on that nobody sees. I'd also give a shout out to our very good research administration team, which helps me to do all the work that I have to do to review and approve projects and to assure the quality of the projects while they're active. So a lot of work goes on behind the scenes that nobody else sees, but it does help us to produce a quality research product, for want of a better word. Also the work that our support departments do, so for example a lot of our studies will involve MRIs or echoes, and our support departments help us out. Without their support we couldn't do a lot of this work, so there's a lot of untold stories and a lot of people supporting an effort that people don't really see, and I guess Red4Research just gives us all the opportunity to do that. We should never forget the patients in all of this, because nothing can be done without patients. And we recruit, I think we had just about 1,800 patients we recruited trials last year. All these patients who consent to be part of clinical trials do so in the knowledge that it might not necessarily help them, but it might help the future patient. So there's a lot of altruism in this, and that's why we provide a holistic environment. So patients will come in early, if they're late we'll look after them, give them a cup of tea, make sure their nurse is available. Thank you for all the staff, patients, principal investigators, pharmacy department, you name it. You know, everybody. It's a cooperative effort. Research wouldn't be research without, for example, the hotel, who help us a lot out. There's really nobody who doesn't help us and support us. So it's just thanking everybody for that and for the gift of their time and their energy to the common effort of making our patients' lives better.